told you that your brain may have already sent you a warning that a stroke was coming and you completely missed it. Every 40 seconds, somewhere on this planet, someone has a stroke. By the time you finish reading this sentence, another brain has been hit. Every year, stroke kills almost 6 million people worldwide, ranks as the second leading cause of death, and is the #1 reason people end up with permanent disability. The part nobody tells you clearly enough. In a huge number of cases, the brain gives you very specific warnings hours or even days before the big stroke happens. You just have to know what they look like. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoyed this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Stroke is not just you were fine, you fell, you woke up in the hospital. In most cases, stroke is the predictable endpoint of blood vessels that have been degrading for years. If something is predictable, it is at least partly preventable. That is the whole point of what I'm sharing with you today. Two very different events. When people say stroke, they are actually talking about two very different events in the brain. One is a hemorrhagic stroke. A blood vessel in the brain bursts, blood pours into or around the brain, forms a clot that compresses brain tissue, and a lot of those patients die. The other is an ischemic stroke. A vessel does not tear, but gets blocked. Blood flow stops to part of the brain, and brain cells in that zone start dying in roughly 4 to 6 minutes. Ischemic strokes make up around 85% of all strokes. So that is what I'm going to focus on today. To understand why every minute matters, you need a feel for how demanding your brain actually is. Your brain weighs roughly 1.4 kilograms, about 2% of your body weight, but it uses around 20% of the oxygen you breathe in and about 25% of all the glucose circulating in your blood. It is a control center that never turns off, and it needs a constant fuel line. Cut that fuel for even a few minutes, and cells start dying in ways you cannot reverse. That is why doctors say stroke is a race against time. It is literally a race to save brain tissue before it is gone for good. The groundwork was laid years ago. Most people miss what I'm about to say. For a brain artery to suddenly block, the groundwork usually took years. The walls of the vessel have been damaged, material and clots have been building up, and the opening has been getting tighter. This is not an explosion out of nowhere. It is the last step of a long process. Along that road, your body usually sends out warning signals. The problem is, nobody ever taught you how to read them. In medicine, those early warning shots are called a transient ischemic attack, or TIA for short. Transient just means temporary. It comes and it goes. Picture a carotid artery, the main neck artery that carries blood from your heart up to your brain. Over years, a fatty plaque forms on the inner wall right where the artery branches. The opening slowly narrows. Then at some point, the already tight vessel goes into a brief spasm. Blood flow stops for a few seconds or a few minutes, and the brain area fed by that artery basically blacks out for that short time. You see or feel a stroke symptom. Then the spasm relaxes, blood flow returns, and the symptom fades, and you think you are fine again. What research actually shows is that a transient ischemic attack very often comes right before a major ischemic stroke, typically within the next 72 hours. Those 3 days are your window where the disaster can still be prevented. Most people do not use that window because the warning episode was short, strange, and then went away. So they talk themselves out of taking it seriously. These warning episodes usually last from about half a minute to maybe 10 minutes. That is exactly why they slip through the cracks. You can be in your kitchen, in the shower, getting out of a car, and by the time you stop and think, the symptom has already passed. But each of those episodes is your brain sending a final, very clear message. I am about to be in serious trouble. I want to walk you through the 5 big red flags and explain not just what they look like, but what is actually happening inside your body each time. Warning sign number 1, temporary blindness in one eye. You get up, walk toward the kitchen, and suddenly one eye goes dark or foggy, like someone pulled down a black curtain over that eye or smeared the lens with gray mud. You blink a few times, maybe rub the eye, and within seconds or a minute at most, your vision comes back. So you blame it on standing up too fast or too much screen time. In reality, that curtain is almost always a tiny clot or a small fragment of plaque that broke off from the wall of your carotid artery, traveled up, and briefly plugged the artery that feeds the eye. The artery to your eye is not some random isolated tube. It is a direct branch of the inner carotid artery that feeds your brain. When the clot or plaque fragment wedges into that tiny eye artery, blood cannot get through. So the retina, the light-sensing tissue, loses its blood supply for a moment, and you see darkness or a smear instead of a clear image. When the clot drifts away and blood flow restarts, the vision comes back, and you feel lucky. You were lucky because that exact same clot could have gone 2 millimeters to the side into a brain artery, and then instead of a 1-minute blackout in one eye, you are looking at permanent loss of speech, paralysis of an arm and leg, or death. Doctors have a classic name for that one-eye blackout, amaurosis fugax, which literally means fleeting blindness. Neurologists treat that phrase like a fire alarm. If a patient describes an episode like that, they get urgent evaluation because the risk of a real stroke in the next hours is high. Hospital records show a pattern where a person ignores 2 or 3 of these eye episodes, and the very next one is the big one in the brain. Warning sign number 2, sudden numbness or tingling on one side. The medical word is paresthesia, but you can think of it as your skin acting drunk. It can be the whole arm, just the hand, half the face, or even one full side of the body. It feels like pins and needles like cotton, or like that body part has turned into rubber. The key detail is that it comes out of nowhere while you are just sitting, walking, or talking, lasts a few minutes, then goes away on its own. You have probably slept on your arm at some point where nerve compression causes numbness that clears up when you move. That is different. There. Your brain and spinal cord are fine. You squeezed a nerve, and as soon as blood flow and position normalize, sensation returns in a minute or two. With a TIA, the problem is not in the arm. It is in the brain area that maps sensation from that arm, and the episode has nothing to do with posture. One more thing worth knowing, stroke symptoms are usually one-sided because each brain hemisphere controls and feels the opposite side of your body. When both hands go numb evenly, that more often points to neck-spine issues. But a sudden one-sided numbness that resolves after a few minutes is a strong reason to get checked for TIA and stroke risk. Warning sign number 3, sudden loss of coordination. The drunk walk. You are on a flat, familiar surface, and out of nowhere your foot lands in the wrong place. Your leg feels weak or rubbery, or you stagger into the wall for a second, or you get hit by a sudden strong spinning sensation that makes you grab a chair or the door frame even though you were not spinning. You did not jerk your head, and you did not just stand up from bed. The part of your brain that keeps you balanced and coordinates smooth movement is called the cerebellum. It sits low in the back of your skull like a small extra brain. It constantly calculates where your body is in space and how hard each muscle should fire so you walk straight instead of zigzagging. The cerebellum gets its blood supply from arteries that run up through the bones of your neck into the back of your head, what doctors call the vertebral system. If blood flow in those arteries drops sharply, even for a few seconds, the cerebellum essentially glitches. That is when you suddenly veer sideways, misstep, or feel violent dizziness for no obvious reason. In clinical practice, I have seen a pattern where people write off these episodes as bad shoes, being tired or high blood pressure, only to find out later that those were cerebellar transient attacks. Benign dizziness usually has a clear trigger, rolling over in bed, turning the head quickly, a known inner ear condition. But spontaneous intense dizziness plus any trouble walking straight should be treated as a possible TIA until a doctor rules out a vascular cause. Warning sign number 4, speech that suddenly breaks down. Before we go further, I want to be clear about something. If you occasionally cannot remember your neighbor's name or you temporarily forget the word for toothbrush, that is not a stroke sign. That is a normal tip of the tongue moment that happens more when you are tired or stressed. What worries neurologists is something quite different. When your speech suddenly breaks down so badly that even you feel something is seriously wrong. There are 2 main speech areas in most people's brains, both usually in the left hemisphere. One area, often called Broca's area, helps you form words and send clear instructions to the muscles of your tongue, lips, and jaw. When that region loses blood flow, you may understand everything people say. You know what you want to answer, but you cannot get the words out. They come out slurred, chopped, or stuck. The other area, often called Wernicke's area, helps you understand speech and organize your own sentences so they make sense. When that zone is in trouble, a person may speak fluently but say complete nonsense, like word salad, and may not understand simple phrases directed at them. If any of those speech problems show up suddenly and then fade after a few minutes, that is classic for a TIA, not I was just tired. You cannot ignore broken speech just because it's self-corrected. That is like your home alarm going off, stopping by itself, and you deciding it was probably nothing. Warning sign number 5, vitiligo combined with new, unusually strong headaches. The fifth warning sign is less obvious and surprises most people. It is a combination of certain skin changes plus new, unusually strong headaches. The skin condition is vitiligo, patches of pale or completely white skin where pigment-producing cells have stopped working. Vitiligo is an autoimmune process, meaning the immune system starts attacking your own pigment cells as if they were foreign. When your immune system goes off target like that, it often does not stop at one organ. In many people, that same autoimmune process can quietly inflame the inner lining of blood vessels as well. That inner lining is called the endothelium, a microscopically thin layer of cells that coats the inside of every artery like a super smooth non-stick surface. When the endothelium is healthy, blood components glide by and nothing really sticks. When it is damaged by inflammation, it becomes rough and scarred and things start to cling. Cholesterol, platelets, various inflammatory proteins forming the seeds of plaques and clots over time. Vitiligo alone does not doom you to a stroke, but if on top of that you develop frequent, unusually intense headaches that do not fit your usual pattern, that combination deserves a proper vascular workup rather than a wait-and-see approach. Headaches in general are tricky because a lot of people blame blood vessel problems when the real issue is elsewhere. A very common cause of daily or frequent head pain is wear and tear in the small joints between the second and third neck vertebrae. Basically, arthritis in the neck. That joint degeneration can irritate nearby nerves and send pain up into the head, which has nothing to do with a brain artery being blocked. On top of that, many people carry an undiagnosed neck disc herniation. And if you never address it, in severe cases, it can threaten the nerve supply to your arms or legs. Headaches should not just be numbed with pills long term. They need to be decoded with a doctor, especially when they change character or pair up with other warning signs like the ones we just covered. What to do if you recognize any of these warning signs? Now, the most practical part. What do you do if you have already had even one of those 5 warning episodes, even if it felt small and vanished in under 10 minutes? You have roughly 72 hours where a lot can still be done to prevent a full-blown stroke. The goal is not to panic, but also not to waste that window. Stroke specialists often point out how important it is not to be completely alone after a suspected transient attack. This is worth planning ahead with your family and your doctor, especially if you live by yourself. If another more serious episode happens and you suddenly cannot speak or move, you need another person who can see it. Call emergency services and get to you quickly. Many people find it helpful to tell a close person what happened and make sure someone can reach them easily over the next couple of days. That is a reasonable thing to bring up with your healthcare provider. Stroke guidelines also advise against driving yourself after a possible TIA. Losing vision or arm control for even a few seconds at highway speed is life-threatening for you and everyone around you. It is worth talking ahead of time with your doctor about what transportation plan makes sense in your situation if something like this ever happens, so you are not tempted to just drive yourself in. Checking blood pressure is usually among the first steps in almost any acute situation. If you or someone near you can measure it, and the top number, the systolic pressure, is around 180 or higher, and the bottom number, the diastolic, is around 110 or higher, that fits the picture of a hypertensive crisis, not just elevated blood pressure. A crisis like that is itself a strong warning sign for stroke, and calling emergency services right away is what standard guidelines often recommend. Ask your doctor explicitly about this threshold so you know in advance when to treat it as an emergency. One rule from stroke medicine is strict. Never start blood-thinning drugs like aspirin, anticoagulants, or similar medications on your own based on a friend's advice or something you read online. There are 2 main types of stroke: ischemic, where a vessel is blocked, and hemorrhagic, where a vessel is bleeding. Thinning the blood can help in certain ischemic situations, but in a hemorrhagic stroke, it can make the bleeding faster and larger, which can kill a person more quickly. The only way to tell the difference reliably is with brain imaging, usually a CT scan in a hospital. No doctor can look at someone and be 100% certain which type is happening without a scan. So instead of self-treating, the right move is to get evaluated and let a medical team decide. While waiting for help or on the way to care, body position matters. Lying down is generally better than sitting bolt upright because it helps blood flow to the brain. Many clinicians suggest a comfortable flat position with the legs slightly raised above chest level to support circulation and ease the heart's work. The head should be neutral, not bent sharply forward and not thrown back so that neck vessels are not kink-egged. It is also wise to avoid smoking, alcohol, or exposure to hot baths or very hot showers in that moment, since sudden vessel dilation in an already unstable circulation can make things worse. Double-check this with your own doctor. Having a written list of all the medications you take regularly, kept somewhere easy to find, is a small step that can save precious minutes for emergency teams, something many people get wrong. If 72 hours pass and no new episode happens, that does not mean you are in the clear. It means you were given a second chance and you still need to use it. 3 evaluations worth asking about. There are 3 evaluations worth requesting at your next medical visit. The first is a Carotid duplex ultrasound, a specialized scan of your neck arteries that shows both the structure of the vessel and how blood is actually moving through it. If the artery is narrowed by more than 70%, surgeons may recommend a procedure to physically remove the plaque. And in modern practice, it is a routine surgery that saves tens of thousands of lives every year. The second is the HbA1c blood test, which reflects your average blood sugar over the past 3 months, not just a single fasting snapshot, making it excellent at catching pre-diabetes before it has quietly damaged your vessels for years without a formal diagnosis. The third is Holter monitoring, a 24-hour heart rhythm recording that catches dangerous rhythm problems like atrial fibrillation, which can come and go and be completely missed by a standard short ECG in a clinic. If AFib is found, well-studied anticoagulant medications can cut stroke risk by roughly 60 to 70%. That is not an inevitable outcome. That is something you and your cardiologist can actively work on together, bringing it all together. Stroke is not a lightning bolt from a clear sky. It is a predictable event that usually announces itself in advance. And the patients who do best are the ones who come in prepared, who know what questions to ask, and who do not dismiss the small warning signs as nothing. If you recognize any of the 5 warning signs from your own life, even from months ago, write them down in plain language and bring that list to a doctor. Do not rely on memory. Ask directly whether you should be evaluated for transient ischemic attacks and whether carotid ultrasound, HbA1c, or Holter monitoring makes sense for your situation. Everything covered here is for your understanding and education, and using it as a starting point for a real conversation with your doctor will always be more useful than trying to manage things on your own. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.